All right, this is Lucas Frankel doing my indwelling catheter insertion. So the first thing I'm going to do is look at my chart. So I have Anna Pawlowski. She has an order for indwelling catheter insertion, and her allergies are penicillin. Her reaction to that is hives. So I'm going to go ahead and knock, wash my hands, and enter the patient's room. I'm going to introduce myself and explain what I'm doing, which is the catheter insertion, and then educate the patient on the process. At this point, I'm going to ask the patient to identify themselves using two identifiers. So I'll use the name and date of birth. So I compare the wristband to my chart. Next, I'm going to ask the patient if she has any allergies, so I can just make sure I compare that to my chart. I'm also going to ask them if they've had any issues in the past with a catheter insertion, and if they state they have, then I'm going to stop and let my healthcare provider or their healthcare provider know. The next thing I'm going to do is ensure comfort and safety. So I'm just going to make sure the patient is comfortable. For the time being, I want the bed down as I gather my supplies. The bed will stay locked, and I just want to make sure there's no clutter or anything else dangerous in the room. So the next thing I'm going to do is wash my hands and put on my clean gloves. And my supplies I have are my hand sanitizer, clean gloves, my catheter kit, and also have tape. So now I'm going to provide privacy by closing the curtain or the door, whatever there is. And now I'm going to put the bed to a working height, which for me will be about up here. And I'm on the right side of the patient since I'm dominantly right-handed. So I'm going to put the side rail on the right side down so I can easily access the patient. The next thing I'm going to do is help the patient into the position desired, which is dorsal recumbent. So they're going to be on their back, and you're going to want to flex the knees and move the legs out. So you flex the knees and out, and the same on her left leg. At this point, I'm going to do perineal care. So I want to make sure there's adequate lighting. I'm going to keep the upper body covered, but I'm going to expose the perineum. So at this point, I would do perineal care using hospital-approved supplies. And as I'm doing the perineal care, I want to make sure I can identify the urinary meatus so that when I go do the insertion of the catheter, it's an easier process and more comfortable for the patient. So now that I've done the care there, I'm going to discard my supplies for perineal care, take off my gloves, throw those out, wash my hands. At this point, you can be wearing gloves or you can just have your hands cleaned. For using the kit, my hands are just cleaned. I'm going to save some gloves. So I'm going to take out the catheter kit from the plastic bag. This plastic bag will be used as a trash can, and I'm going to go ahead and place it at the foot of the bed. So now I'm going to go ahead and open the flaps, one flap at a time. Now that that's open, I'm going to go ahead and just rotate that a little bit so I can make it square. Now I'm going to go ahead and take out my waterproof drape and open it. It is sterile. So I'm going to put the shiny side down and don't touch. Next thing I'm going to do is my sterile gloves. So I'm going to take that over here. My eyes are still on my sterile field. So I'm going to put some more, I'm going to clean my hands again. And now I'm going to open up the package, making sure that the flaps do not retract back onto the gloves, which would make them not sterile. My non-dominant hand, put on the glove of my dominant hand using a sterile technique. And then with my dominant hand, grab the cusp and put on. At this point, my hands are sterile, and I can go and fix that. My wrapper for my gloves are just going to stay over there because it's kind of chilling, not hurting anybody, so I'll leave them over there. Now I can mess with my sterile field since I'm wearing my sterile gloves. So I'm going to go ahead and put that there, move this up, and go ahead and take my other drape put this over the perineum. This is on a female. And okay, so now I'm going to move my box. I'm going to go ahead and take out my tray. I have my sterile field. The bed would be about here, so I'll say that my hands are above my waist. If I were to drop below the height of the bed, which would be about here, or below the height of this bed, then it will not be sterile. So the next thing I'm going to do is go ahead and, so I took out my tray, and I'm going to take out my solution and my lubricant. So I'll take my solution and pour it on top of my cotton balls, and then throw that out. And then I'm going to take my lubricant, and I'll put that in the tray, and then throw that out. Next thing I'm going to do is take out my catheter. And then I'm going to take off this film, being careful with it to make sure it stays sterile. And throw the film out. And also the catheter is clamped. If it weren't, then there would be some leakage, which we don't want. So I'm putting the tip into the lubricant. Now I'm going to take my syringe of 10 mLs, and I'm going to take off my cap and attach this to the catheter. So the next thing I'm going to do is come over to the patient and use my non-dominant hand and use 2 fingers to expose a urinary meatus. I'm going to take my forceps and my cotton balls drenched in the solution. I'm going to go furthest away from me, from top to bottom, go around my sterile field, drop that into the trash, and I'm going to clean closest to me, top to bottom, go around my sterile field, drop that into the trash, and the middle from top to bottom, go around my sterile field, drop that into the trash, and I'm going to drop my forceps at this point, because you only need to use 3. And now I'm going to take my catheter out of the lubricant and grab it about 3 to 4 inches away from the tip, and go ahead and tell the patient to bear down, and go ahead and insert about 2 to 3 inches. At this point, if it can't go any further, you can tell the patient to take slow, deep breaths. If that's still having an issue, then you're going to go ahead and stop and let the healthcare provider know. But I went 2 to 3 inches, and I see urine, so now I'm going to go another 1 to 2 inches. So 1 to 2 inches have been completed, so I'm going to let go with my dominant hand and just hold it in place with my non-dominant hand. And I'm going to inject the 10 mLs. Okay, so that forms the balloon. You can let go. I'm going to go ahead and detach the syringe so that the liquid doesn't go back into the syringe. And now I'm going to just tug a little bit to make sure that the catheter doesn't come out. Okay. And then I'm going to take my catheter bag, coil what's not needed on the bed, and I'm going to open this up, the bag up. I'm going to go ahead and tape the line to the patient's leg, just above the bifurcation. I also want to make sure there's a little bit of slack, so that if the patient moves, it doesn't cause any damage. So I'm going to go ahead and put this below the level of the bladder. So since there's no place for the bed, she's going to hang down there. So now I would go ahead and help the patient. I would clean up my supplies and help the patient into a normal position, comfortable position for them. So I'm going to clean up my supplies. I would throw these out, throw that out. And then I would go ahead and take this out. I'd have to rip it for the sake of keeping it. I'm not going to go ahead and do that. So I rip that. Patient's in a comfortable position. I would go ahead and drape them back. Again, making sure they're comfortable. I've cleaned my supplies. I can go ahead and take off my gloves. Roll those out. wash my hands, and I'm going to document. So I document the amount of urine, the color, the clarity, the amount or the type and size of the catheter I used, and also the amount of water that I instilled into the balloon, which was 10 mLs. So at this point, I again just make sure my patient is comfortable and safe. So the bed is gonna be down, bed is locked, call light within reach, the bed rails back up, so you got 2 rails up. No clutter again in the area. So they're comfortable and safe, so I can go ahead and wash my hands, open the curtain, and I can leave.